The days of driving an hour for surgery are over for people living south of San Antonio. Frio Regional Hospital in Pearsall just hired its first general surgeon in years. Eyewitness News reporter Jordan Foster shares how Dr. Harold Campbell's presence could help thousands in the area.
Hey, Brenda.
It's been about 3 weeks.
Thanks for those note templates.
Since Frio Regional Hospital here in Pearsall, Texas, hired its first general surgeon in more than 10 years, Dr. Harold Campbell.
This is a very humbling experience, but it's also a very gratifying experience to come here in a rural community and really serve the people.
And he's the only general surgeon in about a 120-mile radius.
I think this affects a great deal of people, and there are a large number of people that will benefit from Dr. Campbell's presence at Frio Regional.
John Houston is the CEO at Frio Regional Hospital and says this gives people in this rural part of Texas access to the surgical needs they might have. Before, people would have to travel to far larger areas like San Antonio to get them.
It's just an opportunity for us to help people stay closer to home, around those that they love, the ones that they trust, they know, they see them in the grocery store, they see them at the hospital. That brings a different level of comfort, I think, to our community members.
A level of comfort Dr. Campbell says he grew up without.
I'm from a rural area. I wanted to go back to a rural area. I really enjoy just the culture of rural America.
Frio Regional is designated as a critical access hospital, meaning they have less than 25 hospital beds in their facility. The clear differences between Frio Regional and larger San Antonio hospitals come down to size and resources. But with this new addition, the rural hospital says new opportunities will follow.
People need surgical services just like they need medical services. And for me to be able to provide that to the people who are most at need and have the least access to care, that makes going to medical school and going through a general surgery residency 80 hours a week for 5 years, it makes it all worth it.
Jordan Foster, KENS 5, Eyewitness News.